bless everybody who has anything to do with this special August occasion. All this rescue through Christ our Lord.
Amen. So, ladies and gentlemen, we are going to start the program. Please come forward and take your seat. Give them a round of applause, please. Chief Dr. Agoshuku and Mrs. Agoshuku, the chairman and chairlady of the occasion tonight. Please come forward and take your seat.
Everything I do, we just penetrate.
Good afternoon, everyone. Good afternoon. All protocols observed. It is my great pleasure to welcome all of you on behalf of the Anambra State Association, Women in USA Inc., known as ASA Women USA, to the 2022 Pink and Black Affair Cancer Awareness Luncheon. Today, we celebrate all the cancer survivors for their strengths, tenacity, triumphs, courage, and for breaking the barriers of silence. The theme of today's event is healthcare access to indigent women in Nigeria. ASA Women USA, a registered 501c3 non-profit organization, was founded in 2011 out of the vision to create a platform that advocates for healthcare access to indigent Anambra women with cancer and other maternal health concerns through the provision of health insurance and the establishment of an international comprehensive cancer center in Anambra State, Nigeria. Our solution is to build 3 cancer centers in the participating towns in Anambra State, Nigeria. Our pilot scheme is in Amich Town, Nnewi South, local government area, Anambra State, Nigeria. And we provide a 12-patient chemotherapy treatment suite with brachytherapy treatment. Our consideration of a cancer center will include the following services: basic cancer screening and diagnostic services, surgical oncology, cryotherapy, cryosurgery services, chemotherapy services, radiation and brachytherapy services, immunotherapy services, counseling services. ASA Women USA's project has adopted and enrolled over 71 Anambra women with breast and cervical cancer from 38 communities in the state's own health insurance scheme. And we're working towards the establishment of the International Comprehensive Cancer Center in the piloted Amich Diocesan Hospital. ASA Women USA Cancer Coalition's obligations towards this partnership with Diocesan Hospital will involve the financing, remodeling, and renovating of the already existing wing of the Diocesan Hospital and or other piece of land that may be provided by the Diocesan Hospital to be used for the cancer center. The project is estimated to cost about $2.5 million. The cancer center will provide a full spectrum of cancer care, including awareness and education, screening and diagnosis, access to treatment, support services, scientific research, and equipment. As our founding project partners and stakeholders, ASA Women USA is calling on you to invest in this life-saving enrollment of more indigent Anambra women with breast and cervical cancer in the state's own health insurance scheme and support the proposed building of the International Comprehensive Cancer Center in Anambra State, Nigeria. This aligns with our legacy project to provide the accessible, quality, and affordable health care to the indigent women in Anambra State and the nation at large. But more financial help is needed. We would like to thank our Planning Committee Chair and General Secretary, Dr. Mrs. Josephine Ono, our cancer patron, Dr. Gabriel Ikechukwu Ono Sr., the chairman of this occasion, the chief launcher, special guest speakers, cancer survivors, award recipients, sponsors, friends, and well-wishers for their participation and honoring our invitation. Thank you. Welcome again. Thank you.
Good afternoon.
Very often in this city we have occasions, but there's no occasion like this where people put their heads together and think of the people at home, because there's a lot of suffering down there. And talking about cancer, nobody even diagnoses it before the patients are dead, because we don't have the facilities. People are dying like rats because of simple malaria, because we don't have the government that cares. So really, I'm so excited by what these women are doing. And we all need to join hands and join them, not only now, but in the future. Ladies and gentlemen, can we give these ladies a hand of applause? Of course, you know, we say at home that for every successful man, there's a woman behind him. So is our government. Until our government start paying attention to women, or they have learned to whatever they're not going anywhere. Because the old Nigeria is very good today. I don't think all of us will be here. We could have gone home. So again, without saying much, I'm so delighted with what these women are doing. And I appeal to everybody to join them, because it is a just cause. Thank you very much.
Having a medical background, this is just too exciting for me to be here, you know, because diagnosis, first of all, is the key to treatment. Because if you're able to get this, whatever is going on time, most of these cases will be eradicated. So, I'm happy to be here. I applaud you women. Whatever I can do to help you guys, we're here.
Breast and cervical cancer. So the title of my talk is called Empowered Awareness, because I feel like the first step is empowering our patients to be educated about breast cancer and cervical cancer screening, and being able to communicate with their physicians as far as advocating for themselves. So the objectives of my talk is present the prevalence of breast and cervical cancer, review primary and secondary prevention methods via screening measures, review genetic predispositions that can increase the risk of breast cancer, as well as explore barriers to early detection. So I'll start with breast cancer. So breast cancer is the most common cancer diagnosed in women in the United States. It is the second leading cause of cancer-related death in American women, and Black women are more likely to have later detection as well as more aggressive types of breast cancer. There are several risk factors to developing breast cancer. I'll just kind of name a few. So anyone that has a significant family history of breast cancer, ovarian cancer, or any hereditary breast predisposes you to an increase of breast cancer is also a risk factor, which I'll kind of get into later. Any sort of history of any breast disease or pathology, so if you've had like a lumpectomy for a sort of benign breast issue, that still increases your risk of breast cancer. The predisposed or prolonged exposure to estrogen, so if you started your period at an early young age, that increases your risk. If you enter menopause, which is the cease of your periods for 12 months, if you enter at a later age, say in your 60s, that is an increased risk. Never having a child is an increased risk. Not breastfeeding in the postpartum period is an increased risk as well as increasing age. Let's see, higher BMI, heavy alcohol consumption, smoking is also an increased risk. Dense breasts on mammography, so Black women actually tend to have more dense breasts than other ethnicities, and that is an increased risk as well. And then anybody that's had a prolonged exposure to chest radiation in their younger years predisposes them to an increased risk of overall cancer in general.
I observe all protocols. I want to welcome the members of the High Chair. Thank you for this opportunity to talk about my journey. Breast cancer is part of me, but it is not all of me. In 2014, I was diagnosed with breast cancer, but I was fortunate to have an early discovery. So I underwent a left partial mastectomy. I have to be very careful. I'm not in the medical field, but I'll try. I underwent partial mastectomy, known as breast lumpectomy. The silver lining in my breast cancer journey is that I survived. And one of the reasons I'm fortunate and able to stand before you today is early detection. So it is very, very important, like our young medical doctor said, to examine yourself, go for your regular screening, do your mammogram, and if you have the history of cancer in your family, before the age of 40, you can even have access to this. So make sure you know your rights and responsibilities and what your insurance covers and what your insurance doesn't cover, and find out ways of making sure that you take care of your health. A little bit about myself. I pretty much know everybody here, at least 99%. I was born and raised in Nigeria, and I left Nigeria so many years ago. I attended University of Ibadan, and towards my last year, I met and fell in love, at least I thought I did. So I got engaged, and upon graduation, I left for United States with what we call F1 visa. Before then, I had my plan like this, that once I enter into United States, I'm gonna officiate my marriage, and then go to law school, have 2 to 3 kids, and then have a beautiful house and get a job in a big law firm. But you know what they say about our plans? You can plan all you want. Man proposes, but God disposes. That plan did not work as I had intended it to work. My first marriage did not work. But that was okay. So I dusted myself up and found my way. I went into US Army, then law school, and after that, I met my husband today. And after we got married, I have my law practice and everything was working fine. And then I told myself, I'm going to pick up my dream from where I left off. So now it's time for me to have those 3 beautiful children. And then I found out, oh my God, I couldn't have children. My chances of having children the biological way was very, very slim. I was devastated. But then we decided to adopt. And today we have 4 beautiful children who I love so much. And I couldn't have loved them more, even if I've given birth to myself, to them myself. Okay, so back to my cancer diagnosis, which happened in 2014.
Surviving. Men by nature are very, very stubborn. Yeah. They told me that I have a prostate cancer about 5 years ago, 6 years ago. So what I did was, I speak like one of my friends who's dead today. His funeral is next week. He had prostate. I told him, well, you gotta go to the hospital. He said, well, if prostate kills somebody, let it kill me. I said, well, he said, I didn't die of COVID. I ain't gonna die of prostate. But today, he did, and his prostate is next week. His funeral is next week. So, but I want every man here and everybody here have somebody that have prostate in their life. 1 in every 4 men have prostate. But that's not what I'm gonna talk about today. I'm not a doctor, but I'm gonna talk how it pertains to me and all the people I talk to. I talk to a whole lot of people. I want everybody to take note, the male and the female. Now, this doctor thing here, you got to see the doctor. When you think that you're using the bathroom more often, because one day I was having a meeting with Sam that's sitting there and Basil, so I was using the restroom more regular. They told me you need to see a doctor, but I knew somehow that I have prostate at that time. Then my son told me, prostate don't kill anybody. That it takes a long time for you to die of prostate. So I listened to him, but I took my problem to the American people. I tell everybody my problem. So I talked to my doctor. He said, well, there's 2 kinds of prostate, enlarged prostate and prostate cancer. And they told me mine was aggressive prostate cancer. So I talked to my friends. Some say, well, take wheatgrass, take black oil. So I was doing all that. And then ultimately, I said, I'm gonna go see a doctor because my doctor told me, why you keep on losing blood? I said, I don't know. He said, well, you gotta go take that prostate again. So I went and take the exam 1 more time. So I was at level 7, but this time I was at 11. He said, well, look, you need to go see the urologist. So I went. 2 months later, I was still stubborn. I didn't want to go. So when I get to the doctor told me, nah, you are stage 17. So it was progressing rapidly. So I said, now what do we do? He said, well, you're going to have surgery next week. I said, well, hey, we're moving a little rather too fast. He told me, well, you're going to die. Something's going to happen to you soon. So I told him, well, let me go think about it. Give me my options. He said, 1, that we could take the whole thing out. That's 1. 2, we could give you a prostatectomy, something that goes in your tummy and then goes down there and then they get rid of it. Then the 3rd one is radiation. I said, can I go think about it? He said, you got to make it fast. I said, well, are you working for me or are you after the money that you're going to make out of it? He told me, don't argue with him. So I was very stubborn, but this time my health is in line. So I told him, well, let me think about it. So